Hi everyone. As you can remember, last week we spoke about listening to the patient and not jumping into conclusions as soon as they come in the clinic and we've got things in our head without listening to them. If you haven't seen that video, go back on the YouTube channel, scroll down, is episode 1 of the advice I started giving and the tips to all the sports rehabilitation therapists, sports massage therapists and sports therapists. And the only reason I only mentioned those three professions is just is where my expertise lies in. So that could apply to other health practitioners as well. So part 2, episode 2 today, very quickly, I would like to continue from where we left it last week. So we gave that time to the patient to describe the symptoms. We didn't interrupt because we shouldn't interrupt, as we said. And now we proceed to the treatment room for the next step. Now, most of us, again, including myself years ago, I would jump into conclusions from early doors and I would jump to put hands on the injury or the pain. That's a definite no-no. What we need to do first is understand by listening, as we said last week, what the problem is and how long the problem is been on for, and other things, including the patient's body language, to see whether they are ready for hands-on contact with us or if they just need that initial consultation and advice. Once we've done all these things in the consultation area and we proceed to the treatment room, and let's just say that we've got the consent from the patient to start the next step. The next step is not treatment straight away, is assessment. So we need to assess the situation and we need to look, feel and listen, which some of you will agree that these principles can also apply for emergency first aid situations when you run towards the casualty. We're looking for signs of inflammation, including swelling, redness, and any bruising, and any sort of what we call abnormalities, which one side might be different to the other. Be careful, again, you don't jump into conclusions because some people might have differences already. So it might not mean that the injury itself brought those changes or differences. So be careful with that. Now, we spoke about the look, listen. Listening really is part of listening to the patient even during the examination, because sometimes people remember things that they couldn't remember in the waiting area because they were under pressure or because they had their own story ready to tell you, so they just got it out of their chest. So again, keep listening, keep looking for any changes and feel. That's where the hands-on, of course with consent, will come on, and that's where we will start feeling the problem. Feel for any temperature changes on the skin, because that could be inflammation or something else. Feel for the tissues around the injury. If there is muscle resistance, that could be the problem of the current symptoms. If you scroll down my timeline, you will see something we did with a patient with a knee problem a couple of weeks back, where we were manipulating the bottom of the thigh muscles from the front of the thigh, and the kneecap was moving and it was kind of flicking across with the muscle. So there are connections of joints and muscles which you need to be aware of, and you shouldn't miss, really. So you need to take your time to feel. And there is a lot of other things, I'm sure, on top of my head that I won't remember everything right now, but I'm just giving you the fundamentals and those foundations that you need to be aware of once you have your patient in that kind of treatment area. So again, let's just recap. When we are in the treatment area with the patient, after we have carefully listened to the problem, we will look for how they walk, any differences in their body, one side to the other. We will use hands-on, of course with consent by the patient, to feel for those either inflammation signs or to feel in general for compensations by tight muscles that will give us clues. And the third one, after we said look, feel, is also listen. Keep listening, because the patient will elaborate as I am elaborating now, and I'm stretching that video even further. They will elaborate on their story. So I will leave you with those 3 key aspects, and I will catch up with you next week to carry on.